Hello, doctor. How are you?
Hi there. Good evening, Shriya.
Good. Good evening. Finally, we connected.
Yeah.
There's a bit of a yeah. This is a better angle.
Yeah.
It's been so long. I was telling people that we haven't done these lives, and before we did so many of them, uh,
Yes.
and now after COVID, it's just like yeah, it's a new phenomena now. Um,
Absolutely.
Thank you, Dr. Saab. We're very grateful that you're part of this life. Um, through you, through your knowledge, I want to talk about breast cancer and awareness that we know so little about. Just for you guys to know, he is Padma Shri awardee and also Dr. B.C. Roy National awardee, and I've known you for a very long time, and you've been always very kind and helped me with all my questions, and thank you so much, and thank you so much for doing this.
My duty and my pleasure. And first of all, I'm very grateful to you. This is Surgeons Week. It is being celebrated by the Association of Surgeons of India, which is the world's second largest surgical organization that represents the surgical fraternity in this country. And for the very first time, under the leadership of Dr. Praveen Suryavanshi, who is our president, we have initiated this week not only to create awareness. One of the aims of this week is to create public awareness campaigns
Yeah.
such as this, but also to underscore the importance that the surgeon is also the nerve center for his or her family, and a priority should be to also take care of the healthcare needs of that surgeon, because we've been involved in saving scores of lives on a daily basis.
Fair enough.
The surgeon is a healer and a giver. The healer also needs healing, and the giver also needs to receive. And so Dr. Praveen Suryavanshi actually is logged on Zoom, but I'm sure he will give his message. But I just wanted to emphasize that we're doing this program thanks to you, to create this awareness about the importance of early detection of breast cancer.
Um, and that's very beautifully said. I think we kind of not understand the needs and the importance of doctor. I mean, they're always there when we go for a consultation. They always are 100% present, but we forget to thank and be grateful. Um, and COVID has kind of taught us this, that how important it is for their well-being also.
Other than our president. So, as
Oh,
I mentioned, we are the world's second largest surgical association. So,
wow.
he was in the UK participating in the Royal College of Surgeons meeting. He just landed today, and at very short notice, I requested him to join.
That's
So,
amazing.
Praveen, Shriya has been very helpful to spread our cause. So, over to you if you can say a few words, Praveen.
Yeah, thank you so much, Shriya. I just
Thank
saw
you.
your Instagram post and it's wonderful. It's a really great contribution for the community. Last week only I was there in UK where the
Oh,
92% breast malignancies are early breast malignancy and only 6 to 7% are advanced malignancy. But unfortunately, this ratio is almost reverse in our country. And if you really want to give complete cure to this patient, the only way is to early detection.
yeah.
So I think such activities and uh, you know involvement of person like you will definitely make a big difference for this initiative. I know Rogo is doing since long time, but definitely this will multiply our efforts. Whatever we are taking small efforts. Thank you so much. We really appreciate, and we'll be happy to have for such many more occasions in future also.
Definitely, sir. I would love to be part of this. I think it's very important that we talk about it, and this whole, oh my God, like I was telling sir, that even today, um, when I'm discussing about breast cancer or I'm discussing about, just early detection or going for a checkup, it
Absolutely.
becomes a hush hush conversation. It becomes something that you want to go in the corner and talk about. And I think that very thing has to change, that it's not a taboo topic. It's something that we need to discuss. In fact, as men, I think more than gifting gifts to their women, it's something that they need to take care of their wives, their daughters, their mothers, and this is something that they need to make sure that their loved ones do get themselves checked.
Yeah, looked after, you know.
Yeah.
Right. That's right.
Absolutely.
So thank you so much, Raghu, for making it possible.
Thank you, Praveen. So we thought we'll continue this awareness session here because
Yeah.
this will be recorded and we could utilize this, take clips from this and then play it wherever required. So
Having said that, there's so many problems and misconceptions and taboo about not talking about breast cancer or breast examination. Most of the women I spoke to in my group of girlfriends, they don't go for their regular checkups, and every time you talk about breast examination or regular checkup, everybody goes hush hush, and I think that's the biggest problem, doctor. Don't you think so?
Indeed, breast cancer is a big taboo in our country, more so in rural areas, but also in urban areas. And because of this lack of awareness and being a closet issue, more than 60% present in the advanced stages, where
Wow.
very little can be done to save lives. So it's very important to understand that any woman who notices any new changes in her breast must not ignore, such as a painless lump in the breast, or recent retraction of the skin overlying the breast,
Okay.
or recent retraction of the nipple, or blood-stained discharge from the nipple, or excoriation of the skin overlying the nipple areolar region. When these symptoms are there, they must report to a specialist doctor, and they must have what's called a triple assessment. That is, taking a history and examination by the specialist, then getting a mammogram, which is an X-ray of the breast, and an ultrasound scan of the breast, and if required, if there is a lump, ultrasound-guided core needle biopsy, which will tell us whether or not someone has cancer or a benign non-cancer problem, which is far more common than cancer. In
Yeah.
fact, 9 out of 10 lumps in the breast
Yeah.
are benign. They're not cancers. So therefore, the triple assessment helps to accurately, say whether or not someone has a cancer without the need for that lady going under the knife.
Um, I had a lump in my breast since I was 16, and people find it very scary when they find something, or they like, you know. And the worst thing is, most of women I know, they would rather spend hours taking care of the children or their husband or be their perfect daughter, but when it comes to something about their own health, going and checking, because you don't have to live in fear. Mine is benign, like you spoke about, and just regular checkup is extremely important. And I've been coming to KIMS almost every year, and why I'm doing this live today is for you all to understand is that the last time I went to KIMS for my checkup, without me realizing and without me being aware of it, I had not done a checkup in 2 years. And that's when the doctor, sir, he looked at my reports and he's like, "You're coming after 2 years." And I'm like, "Really? It's been that long? Like, when did time pass?" Um, but how do we create awareness about just remembering that you are also important and you have to take care of yourself?
Yeah, very well said, Shriya. Actually, the woman, just as I said, the surgeon is the nerve center for his family. The
Yeah.
woman is the nerve center for her family. If she is well, the family will be well.
Yeah.
If she is not well, the family will not be well. So it's very essential that she must create time to take care of herself. And the best way to do it is there's no concept, the concept of breast self-examination, which we read about, is given up. And now the term is called breast awareness.
Okay.
So women are encouraged to know how their breasts look and feel every single day, whether it's when they're having a shower or applying a cream. So if there's any new change, she notices it first. As I mentioned to you, some of the symptoms like recent retraction of the nipple, or blood-stained discharge from the nipple which is spontaneous, or excoriation of the skin in the nipple areolar region, or a painless lump in the breast. So if there's any new change, they must report to a doctor. And the second is women over 40 must get an annual screening mammogram. Mammogram helps to detect cancer. Mammogram is an X-ray which helps to detect cancer many years before the lady or the doctor can feel the lump in the breast. So when you pick up cancer that early, we can say that we can effectively cure someone with breast cancer. Normally you don't use that word cure in cancer, but when it is detected that early, we can confidently say that we expect such women to succumb to old age and not cancer. And also there is no need to remove the breast, and there is no also, if the cancer is picked up early and if it is hormone sensitive cancer, there is also no need for the toxic chemotherapy as well. So there are many benefits. The treatment is easy on the patient and it's almost effortless, and we expect women who are diagnosed with early breast cancer to have excellent quality of life and live a very fruitful, healthy life. So it's very important. It's a very simple thing, but even in urban India, Usha Lakshmi Breast Cancer Foundation has been championing breast cancer awareness through a number of initiatives over the past 18 years. And I can say with hand on my heart that we have had success to an extent in urban areas, but still there is so much more awareness to be created, and we should not, in urban India at least, have women presenting with locally advanced breast cancers, which is actually a norm. 60% of breast cancers, if you take overall in our country, present in the advanced stages. In rural areas, unfortunately, there's no mammographic facilities, there is very little awareness, the taboo is even more, but in urban India, there should not be any excuse.
Yeah. After 40.
Yes. So basically, this is an internationally accepted guideline that women over 40, because in younger women, say in 30s, the breasts are very dense. When breasts are very dense, the mammogram, when you take a mammogram, it appears white. And a cancer also appears as a white speck. So it's very difficult to pick up cancers. So a screening test is only recommended when it has a benefit. And as women age, the dense breast tissue is replaced with fatty tissue. So it's much easier to pick up cancers after the age of 40.
And there's a lot of fear that these machines are not good, the radiations are not good, and you should not do it every year. If there is no problem, if everything is fine, why do you want to do it every year? So a lot of people ask me that question also.
Good point. The main reasons why even educated people don't go for a mammogram, or hesitate rather, is two reasons. One is they say that mammogram is a radiation hazard. Mammogram is not a radiation hazard. In this day and age of digital mammography and 3D mammography, the radiation is very, very less. And the benefits of having a mammogram far, far outweighs any risks. That's the first thing. Second is, if it is done properly, the mammogram is not painful. There may be a momentary discomfort, but it should not be painful. And for example, in our center at KIMS Usha Lakshmi Center for Breast Diseases, we train our radiographer to talk to the patient, to comfort the patient, to relax the patient. Good. Yeah, so therefore, once, the patient who comes very stressed, our breast center concept is one where, as I mentioned, 9 out of 10 women don't have cancer. Our aim is to reassure the worried well. Worried because they think they may have cancer, but it's our duty to reassure them through this process of triple assessment. And mammography is an important way to detect any problem or rule out, in fact, any issue in the breast. So there is no need to panic, or there is no need to hesitate to go for a mammogram because it causes radiation hazard or it's painful. It's not true.
Also, you said, a lot of times detection goes unnoticed, and a lot of my friends have complained that their friends had gone for the test and everything came fine, and then 2 months later they were detected with cancer. So as somebody who's trying to figure out where to go, what test to do, what are the guidelines? Because,
Yeah.
this is even more scary when people get detected after a few months of...
It should not happen
Correct.
if it is done properly, if the mammogram is done properly. So sometimes, not all cancers are visible on mammogram. Mammogram picks up 85 to 90% of cancers. But about 5 to 10% and even up to 15% of cancers are not visible. So we always advise women to have a mammogram combined with an ultrasound scan,
Okay.
so that, it's as accurate as it can be. And if it's done with, in the best of hands, so I'm sure, we should not be missing cancers.
Is there any blood test or anything that kind of helps?
That's the future. The liquid biopsy is the future. We are involved in undertaking 2 major trials to see if just a blood test will be able to pick up cancer. So I'm sure that's the next big thing that will be a breakthrough. And so if the blood test or the liquid biopsy comes through and becomes a standard of care, then the first port of call will be to take a blood test. If the blood test is abnormal, then only women will be asked to come for a mammogram. So that's what we're looking forward to in not too distant a future.
Also, if you could speak about how important it is for the men out there to make sure their wives or their daughters or their mums actually go for a regular checkup. Because women, as you know, as I told you, me after being so aware, I didn't realize it's been 2 years since I did my last checkup. So
Absolutely.
how important it is for you guys, because a lot of them are asking me some really silly questions.
Yes.
And I'm like, you should be ashamed, because what you should really do is actually listen to it and actually make sure that you take care of women around you.
As I mentioned earlier, as the woman is the nerve center for the family, it is the duty of the man in the house, whether it's his mother, spouse, grandmother, aunt, friend, whoever it is, sister, it's his duty to ensure that the women in his circle ensure that they have a mammogram every year. We have so many festivals where we gift saris, we give sweets, etc. You can still do that, but in addition to that, I think it's important to gift your loved one a mammogram every year. And by doing that, we'll ensure collectively that scores of lives will be saved in our country.
And you also spoke about, doctor, that the very KIMS has a very beautiful machine, which is one of the best in India.
Well, yes, I think there are now many centers. So when I relocated to India in 2007, we were the first center to have the full field digital mammography system outside of Tata Memorial Hospital. And at that time, there was a lot of ridicule because the digital mammography system at that time costed about 2 crores. But, we were very keen at our institute that we invest in early detection. And so therefore, we invested in early detection. And now, a lot of, since then, a lot of centers across the country have invested in getting digital mammography systems. And now the 3D mammography system has come in, and we have one of the best, the highest end 3D mammography systems. But essentially, it is the man behind the machine. So it's, just as, you may drive 2 different types of cars. One may be a very expensive car, one may not be. But it is the driver that is important. And, it's very important that we have a radiologist who is trained or dedicated to reading mammograms, as well as the surgeon who is dealing with patients with breast disease. He should also be able to read and interpret the mammogram.
Somebody asked me, are there any preventions and what generally is the cause? There's something that we can do or not do, and anyway, we live in this stressful life. So
you have talked about in general. I think it's important to reduce levels of stress as much as possible, and much as we can't prevent breast cancer, but there are certainly, avoiding obesity, regular physical activity for at least 30 minutes every day, healthy diet, keeping a positive, being positive, and certainly stopping smoking. If someone is smoking, they must stop smoking. and reduce the level of alcohol that they take, because alcohol and smoking also is associated with breast cancer.
Okay.
So still, any factor that increases the exposure of the hormone estrogen for a prolonged period of time can potentially cause breast cancer. The highest risk is in someone who has already had breast cancer, but we are seeing a lot of lifestyle changes in the recent past, as a result of which we are seeing a lot of breast cancers. The incidence has increased, and that is late marriages, not having children, having the first child after 30, not breastfeeding, and obesity. So these are all lifestyle factors which can be altered to reduce the incidence. Compared to the West, where breast cancers are more common after 50, the peak incidence of breast cancer in our country is from 40 to 50. So we are 10 years, we are seeing it earlier.
Also, the amount of chemicals that we have in our food, pesticides, and half of the milk that we drink sometimes is not even real. All of that.
Absolutely.
Also,
there are so many factors, but whatever is within our control, we must try and make sure that we utilize them and minimize the risk and detect early, so that cancer can be curable.
and also,
There are only two ways to deal with it. Women of all ages must be aware of any new changes in the breast and report to their doctor. Second is, from the age of 40, every year women must get an annual screening mammogram, and the men must encourage that the women in their lives go for their screening assessments regularly.
family history also matters?
Yes. So one of the risk factors is a strong family history, but it is overrated. So just because my mother had breast cancer, it doesn't mean my children will get. So a strong family history means that there is a genetic predisposition with abnormalities in BRCA1 and BRCA2 genes, and that occurs when, in certain conditions, like certain situations, like when in a family, within the family, close family members, if one or more members in the immediate family are affected with breast cancer under the age of 40, or two or more close relatives have been diagnosed with breast cancer in the family, or there is a strong family history of breast cancer and ovarian cancer in the immediate family, or male breast cancer, because breast cancer can also occur in men, although it's very rare, only 1%. But if there's a male breast cancer, so when this situation is, when such a strong family history is there, that is when women should have genetic counseling before getting the genetic test done. It should not be just done just in case. Only when there's a strong family history, after adequate genetic counseling, they must get this BRCA testing done to know whether they have a family, a genetic risk of developing breast cancer, which means that it would be quite high, very high risk, about 80 to 85% risk of getting breast cancer if the genetic abnormality, that is the BRCA test, is positive. So before doing the test, it's important to undertake the genetic counseling, and it should not be done willy-nilly just because one family member had breast cancer. The reason is the treatment options. There are a lot of treatment options and implications of a positive test, so it should not be taken lightly.
The last question I wanted to ask you, doctor, is when, especially for a mother, breastfeeding, and if you have a prolonged breastfeeding, or if you don't have a prolonged breastfeeding, they both have any implication, or no, it doesn't matter?
Yes. So breastfeeding is protective. So the whole point of breastfeeding is you're interrupting the uninterrupted action of hormone estrogen on the breast. So by breastfeeding, you're interrupting that unopposed action. So therefore, breastfeeding, the longer someone breastfeeds, the more protective it is. But there is also a myth that breastfeeding prevents breast cancer. Breastfeeding doesn't prevent, but it reduces the risk significantly.
Yeah, I mean, it does. And also it's such a beautiful moment between mother and daughter, mother and child.
Of course.
Yeah. Thank you, doctor, so much for your time.
Thank you, Shriya. Very grateful for taking time out. I know you're heading out overseas. Despite your hectic travel schedule, you've agreed to do this coinciding with the Surgeons Week. very grateful to you.
Thank you so much to all the doctors, especially you doctors, for helping everyone, helping all of us, and yeah, sometimes saving lives, and sometimes actually most of the time just making sure that we feel secure about being healthy.
Yes,
Thank you so much.
indeed. Thank you. Take care.
Bye, guys. Thank you all for listening. Thank you for interesting questions. To all you guys who actually ask silly questions, God bless you, because I think this is very important, and I think you should go out there and take care of women in your life because they're important. Thank you.
Thanks for being here. You want to add anything to this conversation? Most
Great.
welcome.
Very nice, very practical tips to the common people. Definitely, it will
Yeah.
go a long way for the to take this initiative ahead. And thank you so much, Shreya, for I'm really appreciating all your you're putting it in the patient own words, simple words, what they feel otherwise as a common man. It's really nice.
No, I just hope that that whole thing when when somebody talks about, oh, I have a lump in my breast, or oh, I'm feeling uncomfortable, I just hope that it doesn't become, let's go to the corner and talk about this, or let's hush hush and talk about it. I hope it becomes more like, you know what, it's something that I need to take care of,
Yes, that's right.
and I think it's more than my responsibility. It should be everybody else, and men should take care of women also when it comes to that, because
That's
we
right.
forget to take care of ourselves.
Very true, Shreya. I think the message is women of all ages must be breast aware. Any new changes, they must report to their doctor.
Yeah.
Women over 40 must have an annual screening mammogram. And it's the duty of the men to ensure that the women in their lives get a mammogram. And despite your upcoming international travel this tonight, you have created the time and to come and then create awareness. And although I said that we have this surgeons week, so you could fit in other commitments, and then you created this more than an hour to be with us. So grateful to you, Shriya. I mean, it's really on behalf of, I mean, our president is thanking you on behalf of the association. I am thanking you on behalf of Usha Lakshmi Breast Cancer Foundation. The main aim is to create awareness so that it touches people's lives, and somewhere we are able to save lives through early detection. Thank you so much.
Thank you so much. Thank you.
Here in Aurangabad, there's one very elite group, and they wanted to have the health checkup done. And when they were negotiating on the package, so they said we can cut down this investigation, that investigation. So as you rightly said, we are given this triple assessment package. Examination, mammogram plus sonomammo. So they say, no, this is too much. We will cut down this package. Let them have voluntarily so that the major cost will come down. I say, don't keep this optional, make it mandatory. We can subsidize something, we can cut down other tests, but keep it mandatory.